parts of our capital, so many people. The Health Secretary, Sajid Javid, says that COVID restrictions are being kept under review and further measures can't be ruled out before Christmas. And there have been reports that some scientists advising the government want a circuit breaker lockdown. Remember them? The Mayor of London, Sadiq Khan, has declared a major incident in the city where an estimated 80% of cases are believed to have been caused by the Omicron variant. Speaking to Andrew Marr on BBC One, he said it was clear that more restrictions were needed.
I think it's inevitable. I think the key thing, though, is for us to have a cool, calm discussion around Cobra, look at the science, look at the trends. But I think if we don't bring in new restrictions sooner rather than later, you're going to see even more positive cases and potentially public services like the NHS on the verge of collapse, if not collapsing.
I know that you will be wondering, as I have been wondering, what is different about this Omicron variant, and why is it so virulent, if you like? Well, let's speak to Dr. Bharat Bankana, who is the Senior Clinical Lecturer at the University of Exeter Medical School. And Dr. Bankana, it's good to welcome you back onto the programme. Why is this variant, this Omicron variant, so much more contagious than previous variants like Delta, etc.?
Oh, good evening, Dotun. My pleasure to explain this to our listeners. So when Omicron emerged, it emerged with a lot of mutations. By mutations, I'd like you to read as mistakes in its reproduction. So with those mistakes or mutations, it has come out favorable for Omicron. So what happened is those mistakes are on very specific parts of the RNA, which codes for making the spike protein. It's the spike protein, that little projections on that spherical thing that we see in pictures that we're most interested in. So changes in the RNA result in changes in the shape of the spike protein. And then furthermore, these changes are at a very typical sensitive part, right at the tip. So these changes alter the shape, and having altered the shape, they make it easier for them to connect, interlock with the human ACE2 receptors. That makes it more infectious. That's the one bit. The other bit is the changes again at the tip of the spike protein are such that the swarm of antibodies that we send its way to attach to that spike protein, connect with it there and then, and neutralize it. The antibodies that we've made, unfortunately, not all of them can successfully connect and neutralize the virus. So that is the reason why we've got hairs running about the new Omicron variant. There are other things to bring in mind as well.
Yeah, no disrespect, but I didn't understand much of that, to be frank.
Oh, really? I'm sorry.
Yeah, well, no, that's all right. It's academic. But the more important question is, do we tackle it in the same way? Is it, what was it? Wash your hands, face, and whatever it was, and keep 2 meters. Is it exactly the same way to tackle it? This is an airborne virus. And you wonder, well, should we carry on washing our hands for 20 seconds, that kind of thing?
Again, this is very important. So this is a aerosol spread mostly, and there is a lot of displacement behavior that goes on with I will wash my hands and I will wash the door handles and so on. The biggest thing is it comes as an invisible cloud in the air. You can't see it, and then it hits your nose and mouth, gains entry into your airways, and sets up an infection. So how should we be tackling this? I have been advising since the Delta variant appeared is the virus has changed to become more infectious. Therefore, we should also change to counteract its greater infectiousness. How do you do that? Well, one of them is wear a better quality mask, a higher specification mask, like a FFP2 mask, which is more snug fitting, better control. So you wear your mask. The other thing is avoid the 3 C's. What are these 3 C's? Getting close to other people, avoid crowds, avoid closed poorly ventilated places. And the Japanese, the Far Easterners, have been deploying this 3Cs very, very successfully. And they also wear their masks properly. And we can just see from their data and results, they are managing to control it much better than we are.
So social distancing, avoid crowds, and try and be in well ventilated
Yes.
places.
Yes.
But as you will know, this Omicron has particularly taken a hold here in the capital, with 80% of coronavirus cases now believed to be Omicron cases. There is an argument, isn't there, to back the mayor's declaration that this has now resulted in a major incident in the capital, just because of the consequences of this level of infection, that our hospitals, first and foremost, will struggle to cope with this. What are the other, do you know what the other parameters are of a major incident when it comes to a health matter?
Yes, indeed, Dotun. So it's anything that affects livelihoods, and health and well-being of the population. And I used to sit on these emergency preparedness committees. So it is really a broad range of parameters. It can range from heat waves to infectious agents to flooding, any number of things that have a major impact on health, well-being, and lives. So Mayor Siddique Khan has declared an incident because there is that rising tide of cases which may translate into hospital admissions and overwhelm the healthcare settings, the hospitals, to look after these ill people.
Yeah, it's more serious in London. Should we be under lockdown, though?
Well, I prefer that if we continued with normality, but we took our precautions. So if we take our precautions, all can be controlled, and yet we are not in lockdown situations. So what are these precautions that we take? Well, avoid the 3Cs, as I said, reduce those 3Cs, as I said, wear that mask, come on, wear it properly. It really does work. And then finally, you see, our government has been talking incessantly about boosters. But if you think about it, the boosters effects kick in when you encounter the virus. As an infectious disease doctor, my advice would be never encounter the virus. Do all you can never to deploy your immunity against the virus. How do you achieve that? Reduce the case numbers. How do you achieve case number reduction? Wear your mask, wear it properly, and avoid the 3Cs.
But not Christmas being a C there. Don't avoid Christmas, though.
No, again, Dotun, there is how was I putting it? Do your due diligence. And if you do your due diligence beforehand, of course you can all meet and have a good, safe time. And the due diligence, unfortunately, should have started a few days ago. So don't be exposed and incubating your infection such that when you are together with your families, 24th, 25th, thereabouts, you become a case and infect everyone. So the due diligence is up to 10 days before you are going to meet. You reduce your encounters with others, your office parties, etc. And then just before you're going to meet, you test that you aren't infected by chance. You do a lateral flow test and all is well and all is negative. You can all meet and you can all meet safely.
I really appreciate that. That's taken some worry off my shoulders, because that was a question mark in my family. I imagine across the country, people are asking that question.
Due diligence, simple as that. And unfortunately, we are on the 19th of December now. So if you haven't started your restrictions, please do it as soon as possible, because the incubation period is 10 days, but you've still got chance. Your due diligence starts today.
Thank you very much. Dr. Bharat Pankania, the Senior Clinical Lecturer at the University of Exeter Medical School. Are you reassured now? Dr. Pankania says, no, go ahead.
Thank you very much.